Vibrio, Aeromonas, Chromobacterium, and other related organisms like Campylobacter and Helicobacter. These are gram-negative rods, and for the shape, they're usually a curved rod, often described as forming an S shape or resembling seagull wings. For motility, these are highly motile and oxidase positive. For habitat, they are found widely in nature and present in freshwater and seawater. For clinical relevance, all genera within this group are associated with diarrheal illness. For transmission and infection, major routes of infection are from drinking contaminated water, eating raw or undercooked seafood, and or having direct contact with contaminated seawater. Some common genera, just for example, would be the Vibrio species and Campylobacter that we'll talk about later. So these gram-negative curved oxidase positive motile rods are significant due to their association with waterborne and foodborne diarrheal diseases. So understanding their morphology, environmental reservoirs, and transmission routes is going to be critical for diagnosis and public health management. We will talk about the Vibrio, Aeromonas, and Plesiomonas. We'll also talk about Helicobacter and Campylobacter. So Vibrio, this is a gram-negative rod that is curved shape. It is oxidase positive and motile by a single polar flagellum. Vibrio is a curved gram-negative rod. It is oxidase positive. It has a single polar flagellum. Growth, so salt. Vibrios will grow at a high pH. And their natural habitat is going to be surface water and sodium chloride for growth, except for Vibrio cholera. Some of the most common isolates are your Vibrio cholera, and this is a severe watery diarrhea that produces rice water stools. And Vibrio parahemolyticus, your most common isolates are going to be Vibrio cholera from raw or undercooked seafood, and then Vibrio vulnificus, which is from wound infections that can cause septicemia and high mortality, and this is often linked to oysters. So for the clinical significance, there is Vibrio cholera, which is transmitted by water and food, and we see this more in areas that don't really have appropriate water supply or sanitation. Requirements of the infection typically does require ingestion of a large amount of the organism. Cholera symptoms are due to excretion of the enterotoxin, or known as the cholera toxin. Patients present with rice water stools, which are colorless, odorless, and contains flecks of mucus. Vibrio cholera only causes disease in humans. Vibrio parahemolyticus infections occur after ingestion of raw fish or shellfish and causes acute gastroenteritis. Vibrio vulnificus appears as a skin lesion after handling shellfish or marine animals, so knowing that patient history is going to be important. And typically, you'll need a special order from the physician to set specific orders so we can actually recover this type of organism. Most of the time, this is going to be from a stool specimen when we're looking for Vibrio. If you have to transport, you can use a Carey-Blair transport medium and refrigerate if it can't be set up quickly. Vibrios do grow on blood agar and MacConkey. They are oxidase positive. Vibrio also likes thiosulfate citrate bile sucrose agar or TCBS. So if you do get that request from your physician, hopefully you have that TCBS agar on hand so you can set and plate it. Vibrio cholera will produce yellow colonies because they're able to ferment sucrose. And so this agar, as you see in the picture, starts out kind of as a dark green. And from there, it will turn to yellow as it ferments the sucrose. Treatment for this is generally just going to be replacement of water and electrolytes because of that rice water stool. Patients will be extremely dehydrated. So if a patient does need to be treated, though, it will generally be 3 days of tetracycline or a single dose of deoxycycline are given to the patient. For Aeromonas species, these are gram-negative rods. They are facultative anaerobe, and they have fermentative metabolism, meaning they ferment carbohydrates. They are free-living aquatic bacteria, which are commonly found in freshwater environments. For reservoirs, they are isolated from cold-blooded animals, including fish, snakes, and frogs, and they can also be found in contaminated water sources. For our medically important species, we have Aeromonas hydrophilia, and this is the primary pathogen of concern in humans. For clinical manifestations, we have gastrointestinal infections that are associated with acute or chronic diarrhea. For wound infections, particularly following exposure to contaminated water, this can lead to soft tissue infections. For risk factors, so patients often have a history of drinking the contaminated water or bathing or swimming in the infected water bodies. Ehrlichiosis can cause gastroenteritis. Gastroenteritis is the most common infection from it. We can also see wounds in possible lower extremity specimens as well. So again, people that are in fresh water with scrapes or abrasions while swimming, that could be a route of entry through that non-intact skin. Ehrlichiosis can be recovered from stool. It grows well in the differential media used for most enteric gram-negative rods. Ehrlichiosis is oxidase positive. It does result in a large zone of beta hemolysis on blood agar. It is resistant to O129, so that will help you separate Ehrlichiosis from Vibrios. That O129 is a compound that's used to assess susceptibility. So if it's resistant, it could suggest that the bacteria has a mechanism to allow it to evade the inhibitory effects of that compound. So Ehrlichiosis is also unable to grow in 6% salt, so that would be another differentiation from Vibrios. Plesiomonas is also an aquatic gram-negative rod. Plesiomonas shigelloides is the most common seen species. Humans are infected by ingestion of contaminated food or water or contact with animals that are colonized with this organism. Oftentimes, this will result in gastroenteritis after the consumption of raw oysters and shrimp. Plesiomonas causes a diarrheal illness, which is usually self-limiting. However, if cultures are ordered, the organisms recovered from the stool will be a colorless or pink colony on MacConkey's because the lactose fermentation is variable on this organism. It is oxidase positive. It does have a flagella, and it is able to ferment inositol. It will not grow on TCBS, so again, that will be a differentiation from your Vibrio species. Is not beta hemolytic on blood agar, and again, most plesiomonas infections are not going to be treated as they are self-limiting. Helicobacter is a curved spiral-shaped gram-negative rod, and it's a strong positive urease reaction. If you do a direct mount, a lot of times you'll see corkscrew motility from them as well. It does not naturally exist in the environment and doesn't have any known host. However, it can be a major cause of gastritis. Helicobacter actually plays a major role in peptic ulcers, so that means it also could be a cofactor in cancer of the stomach. So the fact that it's urease positive, oftentimes they'll actually just do a biopsy of the stomach and embed that into a urease agar and look for a color change. So a lot of times we won't actually get cultures for these, they'll just do the biopsy. So if you look at that picture for the Clo test, you can see there that would be what the little thing in the middle, that's where they would embed the biopsy piece and send it to the lab for us to read if it's positive or negative. Back to Helicobacter. Again, they are urease, oxidase, and catalase positive. The urease activity is typically determined by that biopsy that we talked about earlier. You could use a Skyros media to isolate Helicobacter if needed, but it's not typically identified through a traditional culture method. But if you did do a traditional culture method, it could take up to 7 days for the colonies to actually appear and grow. So again, that's usually why they will do a serologic test or a biopsy for these samples. Treatment would be metronidazole with a 14-day regimen, and then that will generally take care of it. Campylobacter, or Campy, is a small gram-negative rod, once again with an S or seagull-shaped wings, looks like at least. It is motile, and it has a single polar flagella. Campy is a microaerophilic, so we need an increased amount of carbon dioxide and nitrogen. So we'll use that anytime you see the word microaerophilic, you need to think about Campy. Campylobacter is found in the intestine and genital urinary tract in animals, and Campylobacter jejuni is the cause of enteritis in humans. For Campylobacter jejuni, so this is a higher incidence groups for infants under 1 year of age and adolescents and also young adults. For modes of infection, it is from contact with infected animals, consumption of unpasteurized milk, oral anal sexual contact, drinking contaminated water, or ingestion of improperly cooked poultry. Campy is the most common cause of bacterial gastroenteritis worldwide. Campylobacter jejuni is the most frequently isolated species in diarrheal illness. It can cause symptoms similar to Salmonella and Shigella infections, including diarrhea, which can sometimes be bloody, abdominal cramps, and fever. Then we have Campylobacter fetus. This is a less common cause of gastroenteritis and is associated with systemic infections, especially in immunocompromised patients. It can cause meningitis and bacteremia. So once again, Carrie Blair transport media for your stool. They do make a special Campy blood agar plate, or CVA, which is shown in the picture, so it kind of looks like chocolate. That is what you'll be able to use if you're going to be doing a traditional culture on Campylobacter. In addition to the microaerophilic atmosphere, Campy will grow best at a warmer temp at 42 degrees. So you typically will have an incubator specifically set at 42 degrees with that microaerophilic conditions. Your growth will be a non-pigmented, dry, gray colony within the first few days. Because of that, you will hold stool cultures for 3 days because Campy takes that long to grow. So sometimes you won't get anything the first 24, 48 hours at all. So you have to wait that 72 hours to be able to see if you have Campy or not. And then remember, with stool cultures, we're always ruling out. So we're ruling out some of those Shigella, E. coli, and Campylobacter at all times. Again, most of the time, the symptoms are self-limiting. However, if the patient does require treatment, erythromycin or tetracycline will work if the patient is 7 years or older.